Hi, this is Dr. John Martin. Today I'd like to talk about birth control / contraception.
Doctor.
It really isn't just about contraception because sometimes we have other uses for birth control pills. So I try to break it down into gradations. The first is, do you want a permanent birth control versus a non-permanent? So there's only two permanent forms of birth control, and that is the vasectomy for a man, and then a tubal ligation or salpingectomy, that's removal of the tubes or tying the tubes. To me, the thing that you have to take seriously in that question of permanent versus non-permanent is, are you really done having children? And I always bring up the topic, you have to think the unthinkable. You have to think of, God forbid, losing one of your kids, losing your partner, or if you have never had children, do you absolutely not want to have children? Because you hear about the reversibility of permanent forms of birth control, but very commonly now it's done in a way, especially tubal ligations or salpingectomies, that it cannot be reversed. There's no tubes to put back together. You do about hear reversals of vasectomies, but they're very difficult. They don't always work and they're expensive. Now, the interesting thing that I think I explain to people is, I make money off of tubals or salpingectomies, but I actually advocate for vasectomies. They are less expensive, they are less dangerous, and a man can go give a semen sample and make sure that he has no sperm in it. When you talk to a man about getting a vasectomy, we all know that the most important organ in the body is the penis and the scrotum. To a man, that's everything. So they get all freaked out and they'll tell you stories of oh, they heard it's linked to prostate cancer or the impotence, they won't be able to have erections anymore. It's not true. If you talk to most urologists, in the hands of a good, competent physician, there's very minimal complications from it. And really, what I always say is, in the hands of a good physician, there really is no danger to it. And it's much safer than a tubal ligation, because that is a surgery where you have to go inside the abdominal cavity. And anytime you go inside the abdominal cavity, the risk goes up. You can have injuries to the bowel, bladder, major organs, and you also have to have general anesthesia. So to call a vasectomy a surgical procedure, I'd say, is glorifying it, because, again, the most important organs in the body to a man, but really it can be done in the office under local anesthetic, requires just tiny incision and usually no stitches. Whereas to put a woman through a tubal ligation, it's a much more extensive surgery, general anesthesia. So the costs go up, the risks go up. The other things that you hear men say is that they will not ejaculate. It's not true. They ejaculate because you have semen, but there's no sperm in that semen because they've tied off the vas deferens, which is what empties the sperm into the semen. You don't shoot air or dust, okay? Now, non-permanent breaks down to long-term, short-term. There's really only two long-term, and that's the IUD, that's the insert that goes inside the uterus. And there's really three things you need to know about the IUDs. Number one, they hurt when they go in. Once they're in, they don't hurt, but going in is painful. Most women describe it as bad menstrual cramps. Number two, there is an unpredictability of what it does to your periods. Many of the IUDs that have hormone in them make your periods better. You never know until it's in. There are copper containing IUDs that really have to see how that affects your body. The third complication of an IUD is something called a uterine perforation, where it'll erode through the wall of the uterus and poke a hole in the uterus, and that will allow the IUD to migrate outside the uterus into the abdominal cavity, and that is bad. It's a very rare complication, but it can end up in the abdominal cavity and you require surgery to have it removed. The implant, that's the subdermal implant that goes in the arm, and that's a 3-year long-term. They call these long-acting reversible contraceptives, or LARCs. Then you get into short-term or easily reversible, and that's the birth control pills, the patches, and the rings. They are very effective as long as used correctly, 90+% effective, and same thing with the LARCs, the IUD, and the subdermal implant. You just have to talk to your doctor about what's your preference. Some of them help with acne. There is a trial and error with birth control to find the right birth control pill. Some people respond well to the lower dose ones. One of the things I always encourage my patients is, as long as you're not having severe complications from it, really try to take it for 3 to 4 months. With birth control, the things you have to watch out for: there is a small risk of developing blood clots in the leg, deep vein thrombosis, very rare complication, but obviously a serious complication in developing high blood pressure. If you're a smoker over the age of 35, you really should not take hormonal-based birth control. IUDs are fine because they have minimal hormone, but anything that's estrogen-based you want to avoid. There are some progesterone-only pills. Aren't great at regulating your periods. They're used a lot with women who are breastfeeding, but that is an option if you're a smoker because they contain no estrogen. It seems to be it's the estrogen and the smoking which increases the risk of blood clots. The last areas are barrier methods and then rhythm methods like natural family planning, and we'll talk about that. Barrier methods are just condoms, sponges. I think the thing that really is important to recognize with those is even when used perfectly correctly, they're only about 80% effective. So that's only 8 out of 10 times you're good for. If you're okay with that as far as a risk of pregnancy, then it's okay to do that. I say that because oftentimes people will initiate intercourse without a condom on or a sponge in it, and then they'll use it. Well, sometimes that's too late, so you have to be really careful with that. The natural family planning or the rhythm method, where you're trying to make sure that you plan your intercourse at a time you're not ovulating. The problem with that is you can have unpredictable ovulations. Same thing with temperature charts. Those are less effective than the barrier methods. And then there's the most dangerous method, that's the pulling out and prayer method. I think that you have to be very careful when you do that because men can have what's called a pre-ejaculate, and that can contain sperm. And I really recommend that people either do the short-term birth control, that's the pills, the patch, the ring. You just have kind of a discussion with your doctor about that. There is one I call the intermediate, that's the Depo-Provera shot. It's kind of between the pills and patch and ring and the long-acting ones because it has 3 months of birth control. And you can talk to your doctor about that. That's a shot that you get once every 3 months, and that's the Depo shot. And then there's the long-acting, the IUD, and the implant in the arm. Lastly, I think it's important to emphasize that sometimes we use birth control for other medical reasons, like to regulate a woman's period, to help her feel better hormonally. I did a video on hormones, and one of the things we do to try to help women feel better as their hormonal levels decrease over time is give them the low-dose pills. Also, sometimes we'll use it for acne with teenagers. We'll also use it with people who have painful periods or heavy periods. So there's lots of medical reasons that will use birth control or IUDs or something like that to try to help women. So it's not just about preventing pregnancy, it's also to help you hormonally. So that's an important thing to emphasize. So I hope this video has been helpful for you. If you feel it has been helpful, please share it, like it, follow me on Instagram, Facebook, YouTube. Be safe, be kind, and be well.
Doctor, you gotta help me, please.